All right, everybody, if you have heart disease, not a good thing to have, and you want to lower the number of visits to the hospital because of that heart disease, there is a new sleep study that may offer a solution. Dr. Joseph Ojal of the Clayton Sleep Institute joins us with the surprising results. Good morning, Joe.
Good morning, John.
All right, this is interesting. So this was a study using the CPAP machine?
Yes. So our good friends out at the University of Maryland, Dr. Emerson Wickwire, they did a lot of retrospective study looking at Medicare beneficiaries and studying people that had cardiovascular disease, one of the top killers in our society, and finding the people diagnosed with obstructive sleep apnea. And in that population, John, they kind of came up with 1,300 individuals. About 40 to 60% of them have undiagnosed obstructive sleep apnea. When those people were treated, the people that we called high adherers, they used it every night for more than 4 hours, reduced in readmission in 30 days by 60%. So this is a contribution, a real contribution to how we care for patients and little things we can do to help keep them out of the hospital. As from the sleep perspective, I always tell people we're the helper doctors.
Right.
Our great colleagues that are cardiologists, and we're so fortunate to have such great cardiology services in St. Louis. But this gives them a little bit of help, an edge to keep folks out of the hospital. And 60% reduction in hospital readmission, this is a very substantial issue.
Was that the intended purpose of the study?
Well, yes, the intended purpose was to find out if this intervention would both improve their health and give them and reduce readmissions, because readmissions is a marker for people whose congestive heart failure and heart disease is not being as well controlled as we would like.
Which begs the question, what else would a CPAP machine benefit if you had what other type of disease?
Well, one of the things, at least from the heart perspective right now, that we're seeing really a sharp increase are the data on atrial fibrillation, which is a heart arrhythmia, funny heartbeat.
It suddenly happens, you have to get a pacer.
Exactly. Some people may get pacemakers. It's very common. Frequently, the source of that isn't known. What we're finding is many of those folks have risk for or do have underlying obstructive sleep apnea, which is the trigger for their atrial fibrillation. So it's one of the #1 reasons for us to see patients now in the office and the sleep clinic is for a quick evaluation of do they have obstructive sleep apnea or not that's triggering their atrial fibrillation.
So many things happen at night when you're sleeping. You can't tell them. I always look calm, but I save it all up for when I go to bed, and then I grind my teeth. So I now use a mouth guard to keep from grinding teeth. Dentists say, the stress shows itself during the nighttime.
Well, I mean, to the point where on that very issue, I just saw a patient last week. He's had to have implants put in, teeth replaced because of all the teeth grinding. And again, like you, a very calm, smooth individual on the outside, but when all that stress and energy can somehow come out during the night with teeth grinding.
Yeah, we say never let them see you sweat, just get dentures.
I haven't heard what, we'll put that on a poster.
I just coined that. Yeah, that's an original. Good to see you, Dr. Ojal.
Good to see you. Thank you, John.